Good evening. I'm your host, Kit Nascimento, and we are going to be talking about autism. The Rotary Club of Georgetown is sponsoring this program, and the Rotary Club of Georgetown is focusing on autism this year. And I have three persons in the studio with me who are, one way and the other, extremely familiar with the subject of autism. I'm very pleased to welcome, first of all, Dr. Jim Ellis. Jim is a consultant and psychologist who is a specialist in autism, and he's based in Boston in the USA. Dr. Suraiya Ismail, who is an international nutritionist and is the chairperson of the executive committee of Step by Step Foundation. We'll learn a little bit more about the Step by Step Foundation in a minute. And Dr. Cummings, who almost needs no introduction to a Guyanese audience. As you know, Rudolph is the former chief medical officer and currently is the head of the health sector of CARICOM. That is correct. Suraiya, I'd like to begin with you. The Step by Step Foundation, I believe it specializes in the education of children with autism. Tell us a little bit about yourself first, and the foundation.
Okay. Well, as you said, I'm an international nutritionist. I've worked in many countries. I'm also an educator. I have been dealt with training and teaching and so on. My interest in autism began in 2011 when a colleague of mine came to me with saying that her 3-year-old had been diagnosed with autism, and could I find some way to help her in Guyana. I looked, and the only thing I was able to come up with was the fact that the wife of the British High Commissioner then had set up a small homeschool in her garage because she herself had a child with autism. And at that point, I met the wife of the British High Commissioner, and I also met Dr. Ellis, or Jim, as we call him, who was her consultant for her little school and has continued to be our consultant. At that point, Kay, who was the wife of the British High Commissioner, was leaving Guyana, and we registered the Step by Step Foundation as a charity. And a month later, the doors opened of our school, the Step by Step School for children with autism.
So Step by Step is actually teaching students with autism.
That's right, yes, yes. And we took on more tutors, and we have grown from 5 children and 3 tutors to 14 children and 7 tutors.
How many years?
It began in September 2011, right? And Jim continues to work with us and provides training to the staff. He monitors the progress of the children, but I'm sure he's going to tell you about that himself. And he does the assessments and the diagnoses for our children.
Jim, you are a psychologist.
Yes.
You are a specialist in dealing with people, children, mainly, I would imagine, who have autism.
Correct.
You're based in Boston. You function as a consultant in Boston.
Yeah.
So what brought you to Guyana?
Well, as you said, I'm a consultant. I'm trained as a clinical psychologist, and for probably about the past 20 plus years, I've primarily been working with children with autism. Most of my work is working with school systems, working with teachers, training teachers, going into classrooms, going into schools, helping them figure out how to work with children. I spend a lot of time also working with parents, going into the homes, helping them figure out how to work and support their children the best. It just so happened, as Suraiya alluded to, that in roughly in 2008, I was contacted by a colleague of mine who was working in London, who had moved from Boston to London, doing similar work to me, working with families, consulting, working with children with autism, and had been working with his family who was going to be moving to Guyana for 3 years. The father was going to be with the British Foreign Service, had a child with autism, and I got connected with them. I have to be honest, I didn't know anything about Guyana prior to coming down here in 2008. But it's really, it's been a life-changing experience for me, and I have grown quite fond of Guyana and the people here, and have continued to come down here about 3 times a year since that time. As Suraiya said, it was first working with this one young boy, but then it slowly transitioned into doing some parent trainings or a workshop here and there, and then we started this little school with her son and 2 other little boys in their garage. And then Suraiya, fortunately, came along right about the right time when the family was getting ready to leave, and we needed somebody to really help us keep things going. And Suraiya has been amazing in that regard. And we have space that's been donated to us for the past 3 years, which is, above a used car dealership and very modest, but it's working, and I've been able to train up staff. We've been able to get a lot of donations and get our basic needs met, and the bottom line is kids are making progress.
We'll come back to step by step.
Okay.
We're supposed to be talking about autism.
Yes.
We've mentioned the name autism 3 or 4 times so far. I would guess if the majority of our audience are like me, they know very little about autism and what exactly is it. So let me put you on the spot.
Okay. Autism is a neurological disorder, meaning it's a brain disorder. It's generally considered that it's present at birth. It affects children in a number of different ways. It affects their social communication, meaning, well, first of all, one really important thing to keep in mind is that no 2 children with autism are the same. We now refer to autism as autism spectrum disorder, meaning that children fall anywhere along this spectrum in terms of how autism affects them. And when I think about autism, I also think about the different characteristics.
So what is it? Is it a disease?
Nope, it's a disorder. It's something that the individual's brain is impacted in some way. How and why, we still don't know. There's tons of research going on, but we still don't really know what causes autism or what causes this neurological change or this
What's
brain.
the area of medicine that addresses it?
The area of medicine, all areas of medicine address it in a sense that typically it's first identified through pediatricians, through, healthcare providers who are seeing children coming in on a regular basis who start to see some of those signs. But primarily, at least in the U.S., it's primarily treated through the education system.
Doc, let me bring you in here. We have not really addressed autism in any significant way in Guyana, have we?
I don't think so. We address broadly developmental problems in children, and I suspect some of these children are massed together with children who have other disorders. As Jim said, the British child came here already diagnosed and needed support.
Right.
And so that was...
So her mother had a problem.
That was a long way down the road.
Right.
When I started to work in public health here in Guyana, a lot of what we focused on was preventing known illnesses, whether it be malnutrition, immunizable diseases, and so on, which is done through immunization, ensuring that children didn't die from gastroenteritis or from respiratory infections. And we have come a long way in terms of saving lives and even preventing morbidity. I suspect that maybe it's appropriate for us to begin to consider how we could get more involved in the developmental disorders that children may have, and which slip through the cracks in our system very often when children are either in nursery school or maybe in some cases already in primary school. And I think it's recognized that their learning abilities are quite different. They disturb the class. They don't.
And they may think, we may just think they're bad, but they're indisciplined people.
Right. And so I think it's important that at some stage that we begin to systematically address what is obviously going to be the next set of problems that we need to pay attention to if quality of life for our citizens are to continually improve.
Let's say I'm a parent, and I have a child who actually, if diagnosed, is autistic. But I don't know that. What would I look for? What I start to how do I recognize that my child is autistic?
Yeah. As I was saying earlier, when you think of autism and in terms of diagnosing autism, and what a parent should be looking for, and what any professional who's diagnosing autism would be looking for is, impairments in social communication is the first area, and what you might see.
Put that in simple language for me.
Basically, in many cases, children don't communicate. They don't have verbal language, which could mean not necessarily just autism. Children with other sorts of delays in development also don't have verbal language. But the thing that you see in children with autism is they also don't often compensate for it, in the sense they don't use, not only can they not use words, but they also don't point, they don't use gestures, they don't do other ways to try to communicate.
So can you actually begin to see this when a baby hasn't even begun to crawl or stand up?
There's a lot of research that's looking right now at infants, and one of the things they look at, because one of the early signs of autism is eye contact or lack of eye contact, meaning that they don't look at a person's face, they don't respond to another person's showing joy or happiness or fear or anything. They don't show any of that responsiveness. They don't look and try to share what's going on in their world. A very young child will look at something that excites them or interests them and then look back at their parent and like, hey, did you see that? Young children with autism frequently do not do that.
So the first doctors that are likely to detect this are pediatricians.
Very often.
In other words, baby doctors.
Right. And primarily because they are the professionals who are seeing these young children, at regular intervals, typically, whether they're coming in for healthy, well checkups or because there are some medical issues.
Now, do pediatricians have to be trained especially for this? For instance, I imagine in Boston or in a highly developed country, pediatricians might be more alert to this than in Guyana. Would that be true?
Yeah, certainly. Part of the training in those environments, since they don't have the types of infectious illnesses that we have here in developing countries, would be more focused on identifying developmental deficits in children. So Suraiya will tell you there are all kinds of kits that allow you at a very early stage to begin to focus on whether or not a child, if the parent identifies that there's something this child isn't doing, that can actually begin to identify some of these developmental, these neurodevelopmental disorders.
What is the typical age group that you're taking these children in?
Well, what is interesting is we're getting them younger and younger. We're seeing 3-year-olds.
Really?
Yes, 3 and 4-year-olds, and quite a lot of our children are quite young.
Now, when they come into your school, you're not treating them for autism. You're educating them in a different way. Is that right?
Yes, and I think Jim is best qualified to talk about the system that we use, which is called the Applied Behavioral Analysis System.
So is this part of their normal educational system? Are children with autism capable of being educated in a normal way?
Well, as I said before, no two children with autism are alike, so that depends. Some children with autism
to various degrees.
To various degrees, exactly. So some children with autism are able to be educated within a typical educational system with maybe just minor modifications, but many children aren't because the way they learn is very different. One of the other sort of common characteristics of autism is that is also generally considered to be a language processing disorder, meaning that children don't understand language, just as they don't use language as we would expect them to, they also don't understand it in the same way. So if they were sitting in a class listening to a teacher talk to them, they may not be processing and getting all of that information, so they're not going to be learning. They need to have things broken down for them and
Give me an example.
Well, anything as simple as a teacher in a preschool who is talking about what, would happen on a regular basis, talking about the weather or the calendar or what's happening today and going over the routine. Many times, even those basic kinds of things a child with autism wouldn't be able to process and understand, or they might have other behaviors that are getting in the way. So often what you have to do is you have to break that down, break the language down, break the skills down, use a lot of visual supports to help them to be able to process things better, build in a lot of different adaptations to help them be able to learn, and then slowly build that back up. But
Now you have how many teachers?
We have 7 tutors at the moment.
And they are being trained by you, Jim.
correct.
Yes.
And
we do have a senior tutor there who on a day-to-day basis does the training.
now they're trained to do exactly what in terms of dealing with children with autism,
Well, what we do,
as distinct from a teacher who teaches English language or history or something.
well, first of all, what we do,
In fact, let me ask the basic question. Are they teachers? Are they actually teachers?
They're not qualified teachers.
Right.
No.
no, and what makes them different is, I mean, they're trained in, as Suraiya talked about, applied behavior analysis, which is a approach to working with individuals with autism, which is based on years and years and decades of research. And what it involves is sort of what I was alluding to before, is taking whatever skill that we want to work on, whether it be teaching a child how to communicate, teaching them how to respond to questions or directions that come from other people, teaching them how to respond when somebody greets them, whatever that skill is. We assess and figure out where those needs are. We come up with a plan. The teachers learn how to implement that plan, and then repeatedly, many, many times, we present that, whatever it is. If we're just teaching a child to understand and look when we call their name, that might be something that we will work on many, many times, breaking that down,